My name is Monique. I will be performing an abdominal assessment. Hi, is it a good time to come in?
Absolutely.
Hi, my name is Monique. I'm a student nurse with Nevada State College. Here I have with me is Professor Marcellus. We'll both be in to do an assessment on you, okay?
Sounds good.
Thank you. Before I get started, can I have you please verify your first and last name, including your date of birth?
Yeah, my first name is Lysandra, last name Sanchez, date of birth 03/05/1995.
Thank you for that. And do you know what year that we're in?
Yeah, we're in 2020.
Okay, and who's the president?
Donald Trump.
Good. So before I get started as well, I'm going to start with your vital signs, okay?
Sounds good.
All right, let me go ahead and get your pulse. I'm checking your radial pulse. Good and bounding. Okay, Lysandra, so your pulse is at 70 beats per minute. Your respirations is 16.
Awesome, thank you.
I'll go ahead and check your oxygen saturation. Have you stick your finger out. Beep, beep, beep. So your oxygen saturation is 100%.
Awesome.
So very good. And I'll go ahead and check your temperature next.
Okay.
Have you stick this under your tongue. Beep, beep, beep. So I have 98.7. Let me go ahead and dispose this. Okay, and I'll check your blood pressure next. But before I get started, what is a good arm for you?
This one would be fine.
Okay. And have you drunk any coffee or smoked recently?
No, not in the past hour. I haven't.
Okay, so I'm checking for brachial pulse replacement. And what is your normal blood pressure?
It's usually 120/60.
Okay. Is that too tight?
No, that's fine.
Okay. Okay, have you just lift your arm up for me? Okay, Lysandra, I have your blood pressure at 108/66. And so, what brings you in today?
So I'm having a little bit of pain on this side of my abdomen.
Oh, I'm sorry to hear that. So I'll ask you some general questions, get some background information about that, and ask you some questions about your family history and social life, okay?
Sounds good.
Okay. Okay. So can you describe this pain that you're having in your side? Is it throbbing or aching?
Yeah, I would say that it's more of a throbbing pain.
Throbbing?
Yeah.
Yeah. And when did this start it?
It started like 2 days ago.
2 days ago.
Mm-hmm.
And can you point to the exact location?
Yeah, it's right over here.
Okay. In your right upper quadrant. And does it last for about 5 to 10 minutes? What's the duration usually?
Well, it kind of like goes away, but I would say like 15 minutes and then it goes away.
Okay. And the severity is between 1 to 10, 1 being okay, 10 being the worst pain ever. How would you rate this pain?
Yeah, I would say that it's probably like a 4.
4 out of 10. Okay. And what are you usually taking to relieve this pain? Have you been taking any medication?
No, I haven't been taking any over-the-counter medications. Just kind of like wait for it to go away.
What makes it worse? What makes it better?
I would say just like taking a nap or laying down makes it better, definitely.
Okay. And also, are you experiencing any nausea, vomiting?
No, I don't have any other symptoms.
Okay. So, regarding your family, do you know anyone who had liver cancer, stomach cancer, any past surgeries?
No, none of my families. Well, my mom did have her gallbladder removed, but yeah.
Okay. Another gallbladder removed. So, do you drink or?
I wouldn't say I do, but not that often.
How often do you say you drink?
I would probably have like 5 drinks a night.
Do you smoke any tobacco?
No, I don't smoke.
Did you used to smoke any tobacco?
No, I didn't.
Okay. All right, so I'm done with the questions. I'll go ahead and assess your stomach at this time. I'll step out for a second. I'll have you change into a gown so I can get a more clear view of your stomach, okay?
Absolutely.
All right. And I have the gown right there. I'll see you in a little bit.
Sounds good. Thank you.
Mm-hmm. Hi, may I come in?
Yes.
Okay, Lysandra, so I'm going to go ahead and take a look at your stomach. I'll first be inspecting the abdomen. Excuse me. Let me go ahead and pull this up. Okay, so as I'm inspecting her stomach is flat, symmetrical, no abdominal distension, no ulcers, well, no surgical incisions. The contour, like I mentioned, is flat. Her midline to her umbilical is inverted. No redness or irritation around the site. So overall, her stomach looks good. I'm going to now listen to each quadrant, starting from the right lower quadrant and going around. Okay, so bowel sounds are active and normal in each quadrant. Lysandra, when was your last bowel movement?
Yesterday?
Okay. And what's usually your typical regimen for that? Do you go every day?
It depends, not always.
And what's the color usually? Are you passing any gas as well?
Yeah, I mean, I have regular gases.
And how would you describe the color and the texture of your bowel movement?
I would say that it's brownish, light brown. Consistency is solid. So.
Okay. All right, so I'm going to do next is tap onto your stomach, see if I hear anything or hear any tenderness or something, okay?
Okay.
So. Okay, good. No tenderness, no distension, no masses or any organomegaly. So I'm going to now palpate your stomach. Please let me know if you feel any pain or anything, and then I'll immediately stop, okay? So I'll do a light palpation first. Is that okay?
Yeah.
Okay. So I'll go a little bit deeper this time, okay?
Sounds good.
Okay, so my findings, I don't feel any tenderness, no masses, no distension, also no enlarged organs. All right, so let me go ahead and feel for your bladder too, okay? Excuse me. Okay, bladder is flat, it feels like it's empty, no distension. Okay, good. So let me go ahead and cover you back up. Okay, and I'll have you sit up for a second. Do you have any questions or concerns?
No, you've been really helpful. Thank you.
Okay, thank you. And I'll submit my findings to the physician. If you have any issues in between, just definitely give me a call, okay? Nice meeting you.
Nice meeting you. Thank you.
Thank you.